Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with kidney and bladder ailments starting with the letter K, part 2. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to the ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and the metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations in the immune system, then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems of infants, ailments and diseases of childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types had their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with kidney and bladder ailments, starting with the letter K, part 2. In the average adult, the kidneys filter the total volume of the blood nearly 300 times a day, producing about 1 liter or 2 pints of urine. In the average adult, the kidneys filter the total volume of the blood nearly 300 times a day, producing about 1 liter or 2 pints of urine, passed on 4 to 6 occasions. As urine is produced, it filters into collecting ducts in the neck of the kidneys and trickles down the ureters into the bladder. As soon as the bladder is half full, its total capacity is about 1 pint. Stretch receptors in its walls signal the urge to urinate. After the age of 4, the sphincter between the bladder and urethra is under voluntary control. The male urethra, which acts as a passageway for semen as well as urine, is nearly 4 times as long as the female. This, and the fact that its opening at the tip of the penis is well removed from the anus, explains why men are less susceptible to urinary infections than women. Unfortunately, the short female urethra provides bacteria with a relatively swift invasion route to the bladder. Urine, the sterile product of the non-stop filtering activities of the kidneys, is 96% water and 4% organic and inorganic solids, and its color can be a valuable guide not only to the function of the kidneys, but also to the state of the liver and gallbladder. The kidneys regulate the amount of water and also the balance of acid and alkaline constituents in the blood, and on these two things all the chemical functions of the body ultimately depend. Inside each kidney, the branches of the renal artery subdivide into 1 million or so tiny tufts of blood vessels called glomeruli, small molecules, water, salt, various minerals, glucose, and wastes, such as urea, which is a product of protein breakdown, squeeze through their walls under pressure and enter 1 million adjacent tubules called nephrons, which selectively reabsorb them in a healthy kidney. 99% of the water and all the glucose are reabsorbed. This reabsorption process is controlled by hormones made in the pituitary gland at the base of the brain and the adrenal glands that sit on top of the kidneys. The kidneys themselves produce a number of hormones that help to control blood pressure, stimulate production of red blood cells in the bone marrow, and activate vitamin D. Kidney stones. Hard accretions of calcium and other salts that form the large urine collecting ducts in one or both kidneys, sometimes associated with gout, parathyroid problems, or kidney disease. If very small, the kidney stones may pass into the uterus and out of the body unnoticed. If too large to pass into the uterus, they remain in the kidneys, perhaps giving mild pain whenever fragments break off. If a medium-sized stone enters a uter, then becomes stuck, or only gradually works its way down to the bladder, the result is renal colic, waves of severe stabbing or cramping pain that abate when the stone stops moving. Pain follows the route of the uter. Once in the bladder, kidney stones are removed in the same way as bladder stones. If a stone is stuck in a uter, blocking the flow of urine, surgery may be necessary to prevent recurrence. Constitutional homeopathic treatment should be sought. A kidney with a stone in it is vulnerable to infection. In a few cases, scarring from large stones leads to kidney failure. If symptoms are those of renal colic, see a doctor within 2 hours and select an emergency remedy from the list that follows. The appropriate remedy should relax the circular fibers in the uter wall, allowing the stone to descend to the bladder. Specific remedies to be given as often as necessary for up to 10 doses while waiting for help. Stitching pain felt between the lower ribs and the hip bones when urinating. Pain radiates from a specific point and is made worse by the slightest movement, but is relieved by lying on the painful side. Use berberis, 6C. Right-sided pain that stabs towards the genitals and down the right leg, causing nausea and vomiting, or right-sided pain that shoots into the rectum, causing the urge to stool. Weak urine flow that stops altogether on straining to increase flow. Person is chilly and irritable. Use Nux, 6C. Pain in the right side, which stops at the bladder and does not go down into the leg. Also pain in the back relieved by urinating. Urine clear with red sediment in it. Symptoms worse between 4 p.m. and 8 p.m. Use Lycopodium, 6C. Pain darts down the uter, causing nausea and cold sweat. Use Tabacum, 6C. Pain feels like knives stabbing in all directions, burning sensation in the bladder, and intolerable urge to urinate. The person is thirsty but sickened by thought of food. Use Cantharis 6C. Specific remedy: to be given 4 times daily for up to 5 days immediately after removal of a kidney stone. Use Staphisagria 6C. Self-help: a hot water bottle or an ice pack held over the site of the pain usually offers some relief. Recurrence can be avoided by taking some of the following measures. Avoid high-dose long-term supplementation of vitamin C. Avoid calcium and vitamin D supplements. Avoid food containing sucrose and lactose. Reduce the intake of animal protein. Reduce intake of salt and alcohol. If previous stones contain oxalates, reduce the intake of tea, coffee, chocolate, peanut, spinach, rhubarb, and beetroot. Increase the fluid intake, but if you live in a hard water area, do not drink more than 2 liters a day. Eat a high-fiber diet. Take supplements of magnesium and vitamin B6, and lose any excess weight. Kidney tumors. One kind of tumor known as hypernephroma affects the kidneys in adults. It is malignant and causes general symptoms such as fever, weight loss, blood in urine, loss of appetite, and also vomiting, abdominal pain, and reddish or cloudy urine. It can spread to the lungs or bones. Smaller cauliflower-like tumors may grow in the kidneys. The orthodox treatment is removal of the affected kidney, leaving the job of cleansing the blood to the remaining healthy kidney. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.